Medigroup Physician Services presents Medigroup's Frank's Fast Five with Healthcare Executives, produced by Bridget Wilson and Carrie Peters. Today's guest is Joseph Bennett, Associate Director of Business Relations for Organogenesis. Now here's your host, Medigroup's Frank Gillespie.
Well, nice to be with you again, ladies and gentlemen, and welcome to another edition of Medigroup's Frank's Fast Five. Today, I do have the privilege of sharing in some conversation with Joseph Bennett, Associate Director, Business Relationships for Organogenesis. Organogenesis, by the way, is a contracted supplier of Medigroup. So, Joe, it's an honor and welcome. How are you?
Thank you. I'm doing well today. Thank you. How are you?
I'm doing very well for a Monday, Veterans Day. Happy Veterans Day if you served, and for those out there today, no question about it. Thank you for your service and thank you for all you've done for our country. Thank you.
I retired in 2002, by the way.
Joe, thank you for all you've done for our country and all your service. And it's an honor to be with you today. Thank you for taking the time.
Thank you.
Yeah, absolutely. So, Joe, I won't waste your time. I promised you I wouldn't do that. So, Joe, tell us a little bit about yourself and your role at Organogenesis, please.
Well, I've been fortunate to be with Organogenesis going on 15 years. But when you talk about myself and my progression through the company, I have to look back to my military service, right? I joined the Navy right out of college, later moved over to the Army, where I served for 12 years until my injury. I was medically retired in 2002. Okay. But the responsibility, all my good traits, I tracked them back to being a service member for 12 years and then, of course, retiring with a disability. But it's a manageable disability.
Understood. Well, thank you for your service. No question about it. And your role at Organogenesis?
Well, as an account, we call them Associate Director of Business Relations. Most people call them national accounts. I manage a Vizient account. I manage all government accounts. And of course, Medigroup. I work with your team to hopefully bring contractual advantages to our members, and hopefully we're going to heal more patients with our products.
Absolutely. You're most effective for sure. I know our team speaks highly of you. So thank you so much for that. Absolutely, it's true. Joe, can you enlighten us, our members, a little bit about, and I saw this on your website, empowering healing through regenerative medicine. Can you share a little bit about that? Elaborate?
Yeah, the empowering healing, it starts, well, we used to be a company with one product. It was a product called Apligraph that was invented by Dr. Eugene Bell out of MIT. So he spun it off to make a commercial entity called Organogenesis. And that's true regenerative medicine. We take stem cells from neonatal foreskin, a circumcised piece of tissue, and we grow human skin every day. We're growing bilayered, bioengineered human skin equivalents, dermis and epidermis. And then we started growing and started grabbing more. We've invented more things. We acquired some stuff. So we can't say we're just doing just regenerative medicine, but we're empowering through empowering the providers and clinics to heal more patients through regenerative medicine concept and regenerative medicine at best.
Interesting. Very interesting. So, Joe, with that, what is the gold standard in wound care today? Is that regenerative medicine, or are there other things that is all encompassed in regenerative medicine? What is the gold standard in wound care?
Well, I still say the gold standard is Mother Nature, right? You heal yourself, and that's the gold standard.
Okay.
If that's not working, if you see a delay in healing that's not responding to the appropriate antibiotics or compression, it gets down to where is the wound. If it's a diabetic foot ulcer, which are very common, you should always have offloading, debridement, and infection control. If it's a venous stasis ulcer, you should always have control of the infection control, compression, and debridement. And of course, the proper moisture in the wound environment is always important for every wound. But that would be the gold standard. Those are the tenets of wound care. Now, when those don't work, that's when regenerative medicine steps in and gives the body a helping hand through either signaling or through coating or covering the wound in some way, or managing biofilm that's overwhelming the body's defenses. And but the tenets are exactly as I said. They're just very simple. But once those have been tried and failed, then you move on to regenerative medicine.
Very interesting. And the difference too. Thank you for explaining that. Joe, are there any special approaches taken to address utilization of your products in the non-acute care setting? As you know, Medigroup is a non-acute care GP.
Right.
Support available for physicians looking to bring wound care into their practice.
So our company's large enough now that we provide all kinds of support. We have medical science liaisons that if a provider, nurse practitioner, PA, MD is interested, Dio, is interested in doing wound care in their practice, we could probably do some basic training for them. I mean, they should maybe go on and get a certification course. We don't certify providers, but if they have questions about, okay, hey, I bought your product, it didn't work for me, we have some simple questions. How well did you debride? Are you managing, like, basically tenants? Are you compressing the wound? But we do have training within our company to help the providers at any of the non-acute sites become either a better wound care provider or learn the wound care tenets and use of regenerative products. But we also provide the back end. We provide the business support. So if you're a non-acute support, you can't, you do things out of the goodness of your heart, but you can't continue unless you see a business value. We have a business relations team, which is my team. We have a field reimbursement team, which helps them with coding and billing and make sure that they're getting what they're supposed to be getting through their claims. So we have it all. We have clinical and we have financial on the back end or the business side.
Very good. You've got it all covered and all wrapped around.
We think we do.
Well, and it's evident in working with you and some of our patients. So, Joe, as a wrap, and this went quickly, but what do you see evolving, broad question, next in the area of regenerative medicine? Is there a couple things you might see that are evolving, coming next? Look for?
You know, we focus our regenerative healing, regenerative medicine research and healing, whether it's healing an open wound or an acute wound or a chronic wound or a trauma wound. But regenerative healing, if you Google it, it's massive. Regenerative healing or regenerative medicine includes all kinds of almost scientific stuff, or regrowing eardrums. We're not. We are growing and we're manufacturing human tissues and harvesting tissues that will help the body in the regenerative spaces. Regenerative medicine, I mean, for diabetes, I mean, it is an amazing field of study. It should be looked at in every aspect. I mean, brain, kidneys. I mean, there's all kinds of regenerative medicine. And I use Google Scholar, right? Not the Google, but the Google Scholar. Okay. And if you just type in, your specific regenerative healing, regenerative medicine, regenerative dialysis, whatever, you can Google regenerative anything and find some wonderful, wonderful research that's going on. It seems science fiction when you read it.
Endless possibilities. I like that.
Endless. It is.
That's very cool. Joe, thank you very much. I appreciate your time, enlightening, upbeat, and look forward to working with you more down the road. So thank you very much, Joe. I appreciate it very, very much. Thank you.
My pleasure, Frank. Thanks for having me.
This has been MediGroup's Frank's Fast Five with Healthcare Executives, produced by Bridget Wilson and Carrie Peters, and hosted by Frank Gillespie. Special thanks to Joseph Bennett, Associate Director of Business Relations for Organogenesis. This has been a presentation of MediGroup Physician Services.